Why are we doing a talk here? Why is it important for me to talk about golf? Why do I want to kind of pass on some great information? Because I've been that person that really started playing golf, and I will confess it drove me to insanity. I mean, I literally many times, not just once, but I got into it and then I got out of it, and I got into it, got out of it, until I learned, one of my best friends in university, Andrew Robson, has worked with the PGA Tour. He does the Titley's Professional Institute. So I've been working with him for the last 10 years, learning more and more about this, and it's changed my game dramatically, and patience as well, by some very simple things, some simple things that you probably wouldn't think of could make such an impact. At the end of the talk, I'll give you some details where you can go on Andrew's website and see what people have said. But just know this, if you apply some of the things I'm going to show you today, expect to not have many friends, because you will start beating your friends at golf and they won't want to play with you anymore. And literally, this is what we see happen. You think I'm joking? It's that big a difference. And I think if I can just give you a chance to understand I'm not going to get involved with your swing, I'm not going to get involved with your technique, but what I'm going to do is allow you to apply those things a lot better. So my reason for doing this, one is we like to do community talks here, and we try and think of subjects that might interest people, also give you an interest into what we do, and maybe then you would use our service. So even if you don't do that, you're still going to take away a really interesting pile of information about how you can help yourself. What I tend to find with golf, though, is there's so much information. When you try and apply that to a swing, it can just be the worst thing ever. So I'm not going to talk about the swing today. I'm going to talk about what I would do to allow you to do that without thinking. So that's really what I find has really helped me, is I haven't had to think too much, because once I applied the sort of the test that we're going to go through, we're going to run through these a little bit today. We're going to get up and do them all together. It's going to be a bit of a workshop. I won't do all of them. This is my kind of standard of sort of our baseline of where you are. What we'll do is we'll kind of maybe get a couple of people up, or we'll kind of be involved. Is that okay? Is everyone happy with kind of just seeing how crooked and wonky and stiff we are, and seeing if it actually makes a difference? We're going to look at why the spine is so important. For me, there's a number of things going on here in terms of pelvis, spine, and we tend to get a lot of people here with low back pain from playing golf. Now that shouldn't happen. If that's happening, it's because you're not using your thoracic cage. That's restricted, so you're using your low back. So we're going to talk about that a bit later, about why that's kind of one of the key things that I look for to stop you using your low back, because it shouldn't be used in a golf swing. It's just for movement and flexibility, and I'll explain that in a second. The other thing we're going to look at is the health benefits. One of the things I was fascinated, so I had to do a little bit of work for this talk. I didn't want to stand up in front of you and just tell you everything that I know. I wanted to find a little bit more about the benefits of golf, the research behind it, so we could really back that up with all my sort of knowledge as well. One of the things that I found, an incredible study of over 300,000 golfers in Sweden over a period of like 40 years. They found that if you played golf, you lived 40% longer than people who swam or ran. And it didn't matter if you were rich, poor, a woman, a man, made no difference. But the fascinating thing was if you were better at golf, you lived longer. So not only do you get the bragging rights of being better, you also actually stay on the golf course longer when all your friends are buried in the ground. And I just thought that was incredible. And what they kind of put it down to was, obviously, what can somebody tell me the health benefits of golf? Come on, you must know why you play and why you enjoy it. It's not just to play the sport.
Fresh air, walking, which is good
for
mental health.
Mental health, yeah. Men specifically as well. Men's mental health, believe it or not, there's 40% more chance of a mortality with men than there is with women through things like loneliness and mental health. So that's why I'm glad there's more men in here today than women, because you need it more. And I think one of the things I was really interested in is basically the better scratch golfer you were, the longer you lived. Over 300,000 people, so that's a pretty solid study. So why do you think that would be? Why would better golfers live longer? Other than the fact that they're happier because they keep winning, right?
They play more. Might play more.
Yeah, they play more.
Yeah,
What they're also going to do is
exactly in a better condition.
They're going to look after their bodies a bit more. They're going to do things like what I'm going to show you today. And I'm literally selling you a longer life here today. That's literally what I'm selling you, because if you actually look after your posture and you're moving better, and you're actually using it more. And I guess if you're good at golf, you probably pay a lot more as well. So what they found was the people who actually wanted to be better at golf would actually apply a lot more to their game, and they would use this a lot more as well, because there's a lot more thought and practice and re-practicing, apart from all the movement, being out in the fresh air. So how many steps would you do on the golf course on an 18 holes? What would be 10,000 plus, right? How many miles do you think you'd walk?
4.5.
Yeah.
That can vary.
I would say 5 to 7. What I've got written down here is 5 to 7, so 6 is kind of bang on. What else is there? So think about the social interaction as well. You know, I used to play golf just because I liked hanging out with my friends and, you know, laughing and whatever. I wasn't brilliant at it. And then once my sort of man brain kicked in and I realised I was losing every game, I decided to go and learn more about it. And then I got a lot more enjoyment of having the odd. I only need one good hole. In 18 holes, if I have one good hole, I'm happy for the rest of the day. And I think that's one of the things I've learned as well, is not to take it too seriously. But if you do take it seriously, you do want to get better, you do want to improve it, why not enjoy it? Why not feel like it feels like a nice, effortless swing rather than kind of hacking away at it? And once I'd learned that simple thing of how to just swing without effort, because my body was doing the work, not my kind of, I wasn't trying to force it, everything changed for me. And that's something I want to try. If you can just go away with that today, I'll go through some swing things as well. I'm sure you all know how to swing, you've all been trained, I don't know, but I'll show you what made a difference for me and why it took all the strain out of my golf, and I just started seeing the ball go a third further. There's lots of people online who will do much better than me at this, and will show you how to do that. There's a guy called, I think it's David Maud, who I follow, and he just shows 3 simple techniques to kind of do this. So I started applying these things a long time ago. So I've worked with lots of professional golfers, mainly because they come in as patients, and then I end up going with them and helping them, and that's been a really nice part of my job. So that's why I feel I'm pretty well placed to kind of do this talk. One of the other things I found out was when when you're walking around a golf course, especially in the southeast, it's not that hilly here, is it? Would you say? Depending on where you go. Obviously there's the Downs, that's pretty hilly. But I haven't seen, whereas I'm from Wales, and every course is just like this. So you're going to get a lot more fitness from the hills as well. So if you change up your courses a little bit and you vary that, not only is it quite interesting, but actually you get to enjoy the kind of the scenery. That I think that's another thing. If I see lots of nice scenery when I'm out playing golf, I'm just happier. And obviously in England we get the best weather, so we can go and enjoy golf 24/7. Have any of you tried the virtual golf over at the?
Yeah.
How did you find it?
Yeah, it was interesting. I mean, it's the only time I'll probably able to get to play at St Andrews. Although it was virtual.
Yeah, it's kind of weird, isn't it?
It's a bit strange.
Yeah. And again, I think it kind of takes a bit of, I mean, maybe if you really want to practice and you want to get into a great place to do it, but for me it took away the whole point of playing golf for me, and I don't disagree. I think it's great for people who want to get better at it. So what are we going to do? We're going to cover as well some, we've all got one of these, so you've all got these in your thing. So I'm just using it as a reference because sometimes I get up here and I've got all this information in my head, and the moment I stand here, I go blank. So today, if you don't mind, if it's okay with you, I'm just going to make sure I don't forget to say what I've got to say. So one of the things we're going to look at as well, which even if you're not playing golf, is getting better posture. And, sorry,
I haven't got that, the 2 sides, no, the other one.
this one, it should be in your bag. Have you got a bag there?
Yeah, it's got one there.
Okay, I'll get you one of those now. Anybody else? Everyone else got them? So what we're going to look at is core stability and posture. And I'm going to get a couple of people up, or maybe 1 or 2 of you, I'm just going to show you some great examples that I've found, and I'm almost certainly going to find in this room, because it seems to be a really common thing I find, where if you're right-handed, you normally play off the left leg, right? And what I tend to find with people, if you've been doing a sitting job, driving job, anything where you've been sitting a lot, you'll find that this left leg isn't very strong. You don't know it's happening. So when you kind of lean onto that leg and you take that stroke, if this leg is weak, you're going to lose about 40% of your power. And I'll show you, if you like, I'll test everybody in the room. It's a really simple test where you stand up and we're just going to check either side. I think I've done this test with you when you first came in, Jenna, and we definitely found that, actually on both sides, I think. So we're going to do that, and that's going to be something really interesting, because if you're losing that, you're going to find you have to work much harder, but also it actually weakens your entire body. So I'm going to test your arms, but you're going to be weight bearing on either side. It's going to be really interesting. And again, tell you a little bit about yourself. I want to give away some practical things today as well as kind of some information about what I do and how I can help you. Injury prevention, yeah, go into a chiropractor, go into a physio, go into an osteopath. The difference with us, and certainly with me, is I'm looking with golfers or with people who are, I don't know, crossfitters or cyclists, we're looking for specific repetition injuries. So having experience, so I've been doing this for 13 years, I studied for 5 years, got a master's degree, I've always been very sporty, always been very fit, I've always got every injury. If you've got an injury, I've had it. Because I've tried all these, at one point I was doing triathlons, I was doing snowboarding, I was doing climbing, golfing. I just loved sport, I loved doing it for lots of reasons. And I found that, when you've had those injuries and you understand them, it's much easier to treat somebody and also deal with their frustrations as well, because they want to get back to playing. Have any of you done CrossFit before? Correct answer. It is a terrible thing to do. It's just injuries in a room, basically. And the idea is with CrossFit is it's a bit of a cult, and everyone goes there and they all compete against each other and they're all kind of shouting and sweating and getting fist bumping and chest bumping. But it's just one of the worst things for injuries that I've ever seen. And I just found that if you were treating a CrossFitter, no matter what the injury, if they had a leg hanging off, they'd still go back the next day and try and do the fitness while you're just getting them to rest and repair. So what I tend to try and do is when I'm working with clients, whether they're somebody that's a pro golfer, whether they're somebody that's just, Gladys that just wants to get to picking up her grandchildren, I try and keep them doing what they're doing. So we try and keep you on the golf course, try and keep you on that bike, try and keep you doing the things, and then see the improvements within that, because that's how we assess. So one of my jobs is to try and keep everybody doing what they're doing while we're doing the treatment. One of the biggest fears I think most people have is I'd have to stop for a month or stop for 2 months. How's that going to help you in the long run? It's probably going to make things more difficult. You probably get other repetition injuries and restrictions that are going to cause it. So does anybody have any injuries?
Not that I'm aware of.
Would you like some? Sit there for long enough.
I do. I've got 2 prolapse discs.
Ooh. And you play golf?
Yeah.
Were they, do you mind me asking some questions? Is that okay?
You can ask questions.
Were they before the golf or due to the golf?
No, they're work injury.
Okay.
Yeah, I'm a plumbing and heating engineer.
How does golf help it?
Yeah.
Nice.
Yeah, it does.
So that's interesting. So you're probably using your stroke, your swing in the correct way.
Yeah, there are times when
Yeah.
you feel it and you think, right, that's it.
Yeah. If only we could consistently hit it right every time, and then
Exactly.
none of us would be here, or we'd all be out on the golf course now enjoying it. So injury prevention is another thing that we're going to look at today. So if we can get your posture right, if we can get you enjoying the swing, removing restrictions, and actually just not having these repetitive strains, you're going to find that you spend very little time with someone like me. And that's really what I want for people. The less I see of you in the future, if you do go down that road, with anyone we see here, the better we've done. And some people come back for maintenance and they want to keep everything going, keeping the oils, the joints greased, that kind of thing. But it's more about how your nervous system is connecting with the rest of your body. So what we want to do is get this part here. What's this? Yeah, we want to get that communicating effortlessly with the rest of your body. It shouldn't be something you have to really think about and work with. So one of the things I learned with Andrew when I worked with him up in Worcester was that it's actually a lot simpler than you probably think it is. We start with the feet, okay? And what we do is we're going to go through these exercises in a minute, but we look at actual restrictions and we just get things moving that weren't moving before, but in their normal motion related to golf. So if you were going to look at the shoulders, you'd be looking at the movement this way with the thoracic case. We'd want to see how the scapulars were moving. We'd want to see how the clavicles were moving. We'd want to make sure the AC joints were moving freely before we even get to the wrists or to the elbows, which are also going to be. So we look at it in the flow of a golf swing, right? And a repetitive thing that you're going to do every day. So are any of you sort of good at golf? Are there any good golfers in here? I don't know what that relative is. Anybody play off like 5 or something? 10. Jesus, that's pretty good.
10, 12.
It's going up now, yeah. How big was the fish you caught? So yeah, I think that's going to be the key thing here. Most of us do this for fun, we do it for enjoyment, we do it for exercise. The health benefits are incredible. There's plenty of research to back that up. So how do we stay on the golf course? Do any of you play more once a week, twice a week?
Twice, sometimes.
3.
3? So we've got some retired people in here today. And that's kind of where I want to go now. I think I'm at a point now where I'm starting to enjoy the game, starting to enjoy the swing. I just don't get out enough because I'm busy here. So let me tell you a bit about the clinic and why this is we do these community talks. So complete health, we do everything from, we've got podiatrists here, we've got massage therapists, we're mainly a chiropractic clinic, we have a physio as well. We try and look at what's best for the client. And that doesn't necessarily mean you're going to need my help, you might need one of the others. Sometimes it's a combination. This month alone, we actually carried out over 2,000 treatments in 1 month, just in this little clinic here. And it's just getting busier and busier and busier because I think nobody else is really doing this thing where we just offer something for free. If I don't see any of you ever again, obviously I'm going to see you again, Janet, but if I don't see any of you ever again, you know, at least you've connected with us, you've learned a little bit about what we do. Should you have a problem in the future, you're probably going to say, well, I really like that person there, or I didn't like it, I'll go somewhere else. But you're going to know a little bit more about what you need to do, where you need to go, and how it's going to progress. So, why don't we look at the fundamentals? So when you come, let's just say you walk in and you're my client today, and you say to me, right, I'm getting a bit of a restriction. Do you have any problems when you're playing? Is there anything that you kind of notice?
Yeah, ball doesn't go well.
Okay, so let's start. Yeah. So we won't go to, you know, obviously if anybody wants to talk to me later, and I'm going to stay around and sort of chat to you personally, but I don't want to sort of share everyone's problems in the room. It feels a bit uncomfortable sometimes. So basically, let's just say you come in and I've checked you and we found some restrictions. What we're going to look at is a number of there's something, I think we've got 16 different movements we want you to do to see where those restrictions are causing a problem. Now, if you're working with a coach and he's got a video of you swinging, that would be great to see as well. But it's not important to me because everything I do is kind of beyond that. Because whatever we do is going to give you the chance to do your swing the way you want to do it, because it's going to stop the restrictions. So we start with the ankles, we start with the feet, because if you think about it, the movement required there and your connection with the ground is really the key thing. Now, golf is a game of little margins. So for me, the devil is in the detail. Those little margins, a tiny little stroke to the left or to the right, maybe a couple of millimeters, can make the difference between this and this, right? And changing the position of your hands, changing the position of your posture. If you get those things right, the consistency comes back to the game. And obviously, if there's no resistance and no reason to change and adjust your posture because your posture's working and it's moving better, you're immediately, regardless of whatever problems you've got, it's going to improve because you're going to be allowed to do what you want to do. Very often, I go to hit the ball some days. I've had a really busy week at work. I've seen tons and tons of patients. I've been working really hard, and I go to hit the ball, and I already know this isn't going to go well. Has anybody had that feeling? And you don't know why, because you're kind of going, I'm going to do what I always do, and it just goes dunk, 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 or it goes vroom over there. So trying to take that out where there's this kind of natural movement where no matter how your brain is thinking, you're still going to do some reasonable straight shot. And that's really what I've been helping people with, is getting that natural movement in that swing. So what we look at is how you move in a way where you're, obviously if you're driving, I tend to bring my feet a little bit further, I tend to shift as I drive, I tend to move, and if your pelvis is stable, we're going to look at the way it moves forward and side to side. We're then going to look at dissociation. So we want to separate the shoulders from the pelvis. And this is why some people get back pain, because they're actually using their whole body instead of separating the two to get the movement and using the thoracic cage. This is something I learned that was like a revolution for me. It's actually the thoracic cage that should be doing the movement. And if you've got restrictions in your shoulders, clavicle, AC joint, and your neck, what is going to happen is you're going to start to bring your back into it. And the moment you bring your back into it, things start getting uncomfortable, especially if you've got, most of us have got some degeneration in us once we have, unless you're like 17 and never done any sports, you're probably going to have something that can get damaged. And we try to factor that in as well. So avoiding injuries or recovering from an injury, or improving the way you play so you're getting less discomfort and you're getting a better game, is essentially what we're aiming for. But it starts at the base level. So what's your name, sir? Jim. So Jim, you turn up and we go, okay, let's have a look at your swing. You've got a little video you're going to show me. it's important in a way. But what I'm going to do is I'm going to take a scan. Let me show you these here. So we do these with clients. I'll pass this around in a second. And what we do is we want to look at your posture. Even if you were a golf player, we do this with every patient because let me tell you, whatever problem brought you in, posture is going to keep you out. That's what's going to stop you needing me in the future if you get this right. Because if you think about it, most people I see, especially golfers, will have a forward shoulder carries like this, and it's not because they've been playing golf. It's because most of their life they've been doing this, or even doing this. Okay, so most people we see are going to have this. Now, do you mind standing up for me? You seem like a willing helper. So my colleague did this last week. We were doing a talk on shoulder pain. So if you mind looking that way for me.
Yeah.
So and we're going to do this together, okay? So what I want you to do is raise your arms up like this. How does that feel? A bit restricted at the end there?
I had a click on my shoulder.
Okay. Now what I want you to do is come forward a little bit, like this. Now I want you to raise your arms up and see how much more difficult that is.
Yeah.
Much harder, yeah? And you can feel it in your back as
Feel
well.
it,
Yeah. So thank you very much for that. Take a seat. So basically what we find is obviously depending on the change in position, it changes the way your joints move. So we need to kind of see you in all different positions, and then we get you to kind of do 90 degrees rotations with the arm, because unless you're in, it's no good me just going around and checking. But if your posture's not right in the first place, those things are going to be a problem straight away. So we want to get the posture right. So even just from our normal treatment program, checks, neurological tests, orthopedic tests, posture first. Then what we look at is how that posture is relating to your swing and how we can do some tests. So I've got these, we're going to run through these now because I really like this to use this as my base, and then we can work off that. If you've got any questions, if any of you want to give that a try. So I'll do a couple of these to show you, and then I'll get you to do a couple seated as well, because there's a couple of seated ones that are really good, right? So for me, what would be if we had to choose, what would be the most important movement in golf? It's not a trick question. Rotation, right? Yeah. Probably, I would say it's probably the most important thing. So that's going to be the start for me. So what we're going to do is we're going to look at some rotations. We're going to look at your neck. Does everyone want to do this with me? You're all saying no? No? Okay. So rotation of the neck, and if you feel a little bit of restriction, we'll find that. We'll check what's causing it. We'll get that moving better. Then we're going to look at the rotation of your shoulders. So again, you can just lean forward a little bit. Try not to hit the person next to you. If we all do right arm. Right arm, okay? So try and get your arm in a 90 degrees position. So it's straight and lean forward. What I want you to do then is just bring the arm up. Yeah, it's quite difficult to do in this position. So come up a little bit, come up to about here, and then you're going to do the same thing and you'll feel it's a little bit better. So what I would suggest to people is instead of going right down like this, maybe come up a little bit so you can actually work with it until we get the shoulder working a little bit better. It's going to bring down issues with the shoulder. Then we're going to find any restrictions around that area and see if we can actually get that working better. The other rotation we're looking at is the thoracic cage. When you're sitting, it's better to do this. So what I want you to do is all do this. Pop your papers down a second. I want you to bring your knees together. Like this. Just lean forward a little bit. We don't want the hips moving, we don't want the knees moving. If the knees do this, it's a fail, okay? Okay, so we're just going to move, shoulder, and then shoulder back the other way. And again, we've actually dissociated the pelvis. So I'm looking at your knees here. Yeah. So when you go away today, can you see this? Some of you, I can see that you're a little bit restricted there. You can see it's quite difficult. You're actually pretty good. You were moving pretty well, you were moving pretty well, and this is something, again, we're going to find little restrictions around the ribs and around the thoracic cage, get them moving a bit freer, so we're taking pressure off the low back. If your low back is getting loaded, as we said before, it's a really, really difficult thing to deal with, whereas if you're getting restrictions here, it's much easier to free those up and get moving. Again, we're going to look at how these nerves respond to that a little bit later. So the other thing we want to get rotating as well is your forearms and your wrists. So again, while you're sitting, you can just bring your arms like this, and you're going to come right over, and then as far as you can that way. And you'll see my left one is struggling a bit more than my right. And again, bring your elbows in like this now. Does anybody play golf with their elbows in? Yeah. Try. It's much better because you're using the flow. The moment you bring your arms out, you're putting so much pressure in your shoulder and losing weight. So bringing the arms in, try that. And this is a nice little kind of way, tuck the arms, keep the arm, you've got to keep those elbows tucked in there, that's it. And then you're rotating without moving the elbows. And again, if you think about what that's bringing when you come up, you're rotating and then you're rotating down. I like to do my grip a little bit more that way. I found that if I got 3 knuckles showing there, I just seem to hit the ball straight. Whenever I try and go around that way, it just goes into a hook. So again, having those options, having that movement. The other thing we're going to do is bring the wrists up as well. Again, tuck the elbows in first, and then you're going to go all the way down. And then again, we're going to look at restrictions in your calf balls. We're going to look at some tight muscles, because when you're doing something repetitively, you tend to build up a bit of lactic acid in the muscles, so freeing those off. Okay, anyone got any restrictions there? Feeling good?
Most of the things you there was restrictions.
So I'll do a couple of other ones where sort of stood up, because I think these are, again, like torso rotation when you're, so obviously the sitting one's really important. So one of the things we do is upper dissociation, lower dissociation. Does anybody know what that is? So basically, when you're, let's imagine I'm about to drive, so I've got my feet a little bit wider, I'm in a good position like this. I didn't bring a golf club in today because we've got too many windows in here, and it's just, my track record isn't great. So basically, imagine you're, let me use this because I thought this is my little golf club. So imagine you're setting up, you're kind of getting ready like this. What you want to do really is you want to keep your eye on the ball. And that's the bit where if you can dissociate the pelvis from the shoulders, you can load that up without, it's very, when you start moving the pelvis, your brain wants to go with it, your eyes want to go with it. When your pelvis is still, your eyes are dead straight. I don't know why that is. There's a connection between the two. So if you're just doing this and you dissociate the lower pelvis, there's going to come a point where you need to bring that across, but you'll definitely stay looking at the ball, which is, as you're probably aware, is probably the key to this. The amount of times that I've gone to do this and I do that, and then I look that way, instead of just sticking with it. So when we did dissociation, when I did it first of all, I found it was much easier to stay focused on the ball. Then we want to do dissociation, keeping the upper body still, and doing dissociation of the hips. So moving them, try not to move my shoulders, it's really difficult to do. And again, it starts to separate those two things so you can actually focus on the ball, not go into this kind of thing that's going on.
Can I ask a little question?
Please do.
So, when we all look at these little mini pop-up Google things on our phones and stuff. When you see these top pros, the Dustin Johnsons and stuff, they're super strong, they're in the gym 5 hours a day or whatever, and they basically have a whitish stance.
Yeah.
They're super powerful here.
Yeah.
They hardly move off the ball at all, because that's ideal.
Yeah.
If you can do it.
Yeah.
But what I've tried that, and at I'm 70 and stuff, so that's what really gives me sort of lower
Yeah.
what's it called, sacroiliac.
Yes.
So the old school sort of Tom Watson method, you go, you slightly move off it to the inside of the right foot,
Yeah.
and then come back.
Yeah.
It's helped quite a lot. So
Yeah.
what would you comment? You see what I'm saying?
Yeah.
At the top flight, it's all very well not moving off the ball because they're so strong on the
Yeah.
torso. The whole thing is in the turn.
So there's a guy. I'll find him at the end, and I'll give you the thing. But one of the ways he does this is getting people to kind of do the pendulum, right? So you're basically, and he'll do it with a towel, and he'll do a thing, and he's got this really old guy from America over to see hit the ball, and it is insane. He just gets him to kind of do this thing where he goes, okay, as you come down, imagine pendulum swing back and forward like this. And he gets him to hit the ball, and he hits it about 50 yards further for the shot. And all he's doing is creating a swing that is allowing the momentum as opposed to the force of trying to hit the ball. And this guy he's smaller than me. It's laughable, and the ball just flies dead straight. He changes his thing, and I know that's not going to apply to everybody here, but it is about doing a little bit. With your swing, it's about finding that little bit of everything we can momentum wise to actually do. It's a bit like he described it like sort of flicking a towel. When you kind of years ago you go like this. It's a bit like that. As you come down, you just flick, but it's the momentum, so you're not trying to force it through. And this little old guy from America is just going, wowza, look at this. And it was beautiful to watch. And I saved it on my phone because it's just something I want to get better at, something I want to improve at. Because I want to do this until I'm 70, 80, 90 years old. I do. And golf for me is not, it's not a passion. It's something that's much more than that. It's like a lifestyle. I don't want to be in the club with all the guys and the cliques and all that. I just want to be out. I want to be out hitting the ball and enjoying time with friends, things like that. So I just want to do that effortlessly. If I'm not doing that, it's not going to be long before I get injuries, and it's not going to be long before we see all the people that do this kind of thing. I've got a patient at the moment, so I want to give you a couple of examples of people that I've really helped. He's plays golf twice a week, and we took an X-ray. I won't mention his name. He took an X-ray, and we found that he had something called dish. So we always X-ray our patients because it's a safety first thing, right, more than anything else. And once you see the X-ray and I see the X-ray, we both know that I know what I'm doing, okay? Because it's not my opinion; it's just black and white, right? So we took an X-ray of this guy, and we found that he had something called DISH, which is diffuse idiopathic skeletal hyperostosis. It basically means that this is all calcifying together. It's sticking together, and it's diffuse. It goes down the spine. The spine looks like a bamboo. It's crazy. So he actually works on a farm as well. He's not a young man, and he wanted to play golf. So all I did was work on just freeing up some of the muscular tension, freeing up some of the nerves where they were restricted, and getting the joints to move better. And his response has been incredible. And I think I've been seeing him about 4 weeks, so it's quite quick, the difference. And now we're working on his knee, which he didn't think we could do anything for, because now his pelvis is working better, his knee is responding better, and we're starting to see him really enjoy his golf. He's coming in with less pain, less restriction. But his thing is, if he stops playing golf, this is going to overrun him. And it's not life or death, but it's like movement or not movement, mobility or not mobility. So when we think about what golf gives us in terms of mobility, can anybody think of one thing on this planet, anything at all, that is more valuable than mobility? Try and think of something.
Oxygen.
Breathing.
Yeah, but let's say you're breathing, but you can't move around because you haven't got your mobility. Yeah, they're very close. I mean, obviously, the ultimate lack of mobility is dead, right? So
I've got a friend actually who's been suffering for a number of years. He's had operations on his back and all sorts. But we were talking about it at home this week, and it's very limiting what he can do.
Yeah.
And I'm thinking he can't do his current job, but actually, what job doesn't use your back?
Yeah.
And I was really trying to think, what could he do? He must, because he needs a purpose. So.
I mean, I exactly, and I think when we live in a really, I'm from Wales, where we all just walk in the rain all day long. We're out all the time. I came to Eastbourne. I lived in Brighton for a while in the Downs, and I found the Downs to be one of the most beautiful places, to enjoy living. And every time I go out and every time I walk with I've got 2 little dogs. Me and my wife, we go out walking. Honestly, this job it literally gives people their lives back. It gives them their mobility back. The thing that I do, my purpose is giving people back their purpose. If you can't go out for a walk and you can't go out and do simple things, everything changes. And it's not just your physical health, it's your mental health as well. So for me, this is, the golf side of it is just a nicer way to enjoy walking. Because what's the famous saying? Golf is a good walk spoiled. I disagree. Golf is a good walk with something to do, which is a bit of fun. And if you're good at it, or better at it, or bad at it, it's still something to do. So I think, if someone chucks me a football, I'll run around for 2 hours. But if someone says run around for 2 hours, I'll be like, oh, I'm knackered. If there's a motivating factor, then golf is a good walk that's just got more fun things to do and more enjoyable, and gives you something to think. Because you're having to think about the distance, the club, what you're doing. You're using your mind as well. And I think that is such an essential part to this. It isn't just about the physical mobility, it's about the mental mobility as well. So my job is all about trying to keep people doing the things they love doing, whether that's golf, whether that's cycling, whether it's climbing. And that's where I try and specialise in certain things so I can give people the right treatment. So I've just asked that every time someone comes in and they do something they want to get back to, I just have to learn more about that thing. So this is something I've just had to do over and over again. If you help one golfer, guess what? They're queuing up outside because they all want to beat their mate and they all want to get better. And he's just, wow, he's hitting the ball further. How are you doing that? Oh, I'm seeing this chiropractor. Right, I want to see that guy. And it just becomes a snowball. So I have a lot of people who come regularly just to maintain their golfing ability. So I'll go through a couple more tests on here as well. So one of the things that Andrew, this comes from the Teat List Professional Institute as a baseline test, right? But one of the things we found is it doesn't always relate to getting better at golf. And it is about getting your posture better, about getting out of pain. But one of the things we do is we've kind of refined this a little bit over years and years to get the things that matter to golfers, and so it does make a difference. So they do like a squat test where you have to hold something over the top like this. You know, you hold the golf club over and you do a squat. Can you think of any time that helps you in golf? I'm not sure there's any benefit to that, and we found relative to golfers that made no difference at all. So we've kind of refined things to actually get better. We do some core strength in here as well. What we do then, once we find, we sort of, what I do is I sort of give you a green, an amber, or a red. Okay, it's as simple as that. So you know exactly, you've got the sheet, you know the things you've got to work on. So what I do then is I give you specific exercises to improve these things as well as treatment. So it's a teamwork makes the dream work scenario. And the only way we're going to see results is A, you feel better, B, you're sleeping better, you're feeling happier, but also we're seeing a difference on the golf course. There's less restrictions, less problems, and you're getting a better quality game. Whether that means you're getting a better score, I don't know about your technical skill, but just feeling like you're enjoying the game more and it's more effortless. Does everybody think that is a desirable outcome? Yeah. Does anybody find it quite an effort? Playing, do you find it quite sort of...
In the winter, I think, because you play a bit less and you've got more on and everything, it's a bit more of a hassle.
Yeah.
I find, because I play up the downs, so, on a day like it's been the last couple of days.
The windy, rainy...
Yeah, all of a sudden a par 5 becomes a par 7 if you're not careful.
But you still go out, you still go out 3 times a week?
Yeah, absolutely.
Respect. You do well in Wales. You'd be a good Welshman. So I'm just going to pass this around. I'm going to show you what happens in just a few months when we work on people's postures. Have we got any more of these?
I've got the frame, the one in the frame.
Ah, yeah. So we'll pass the frame one around as well. I'll just give you the frame. So let me put this at the back. If you pass that along, just have a look at this. So these are before and after pictures of people we see over a couple of months. The guy on the top is obviously a little bit older, the guy on the bottom is a bit lower. But these are sustainable changes, and it's funny how we allow ourselves to get into this. So what we do here is we always scan you when you come in, and then we scan after a certain amount of time. So normally about 6 weeks, and the difference in 6 weeks is incredible. We have pads with loads of people that have gone from that to that, but these are the ones that we use as an example because they're the most kind of relevant. Most people have full head carriage. Most people have a little bit of a kink in the pelvis, and obviously getting those things to line up makes everything easier when you're trying to get a consistent swing. Because if you've got one leg shorter than the other, and I can assure you everyone in this room has, I guarantee you, because I know osteopaths, you say, oh, you've got one leg shorter than the other. Everybody has. So mitigating that and working with it, understanding it, and then getting your posture to kind of work for you means you're going to get a much more consistent thing. If normally left legs are shorter, generally, if you're right-footed, and then what we're going to do then is just we're going to look at that scan, get it to improve, and then see how it relates to the other tests in here, and then the tests we do later on. So my biggest and most important thing to achieve with any patient is to get these nerves working with your joints and your muscles. So here's a question for you. If I was to take away this metal pole here, what would happen to this skeleton?
Fall on the floor.
Yeah. So why am I standing up and that would fall on the floor? What's the difference? Apart from being alive.
Muscle.
Exactly. And what fires the muscles? Yeah. Through what system? Nervous system. Perfect. Great. Straight away, that was the easiest answers I've ever had for that. You 10 out of 10. So basically what we want to do is we want to get this communicating with all these areas here in an effortless way. Now, do you mind standing up for me? We play 3 times a week. So I'm expecting a few issues, yeah. So we're going to do a really simple test. So remember I told you about this earlier. So can you bring your arms out straight for me? Come and stand right this way so everyone can see. So what we're going to do, I'm going to push, you're going to stop me pushing, okay? Show me how strong you are. So I can see there's a bit of an issue on this side.
Yeah, I've got a little bit of tennis elbow on that side.
Okay, now I'm going to show you why. So I can push you down easily, yeah? Would you say?
Yeah.
Okay, put all your weight on your right leg. Now do the same test. Feels better, doesn't it?
Yeah.
Put all your weight on your left leg. Now watch what happens. Nothing at all.
I busted my ACL playing football.
Yeah.
About 14 years ago.
Okay, so do you think that's the cause?
It just, sometimes I just feel as if it's just,
Okay.
I think you're just very mindful
Okay.
of it. So when I'm I'm left-handed
Yeah.
and left-footed and everything.
Okay.
So when I'm sort of trying to drive through, sometimes I can just feel,
Okay.
you know, I think a lot of it's here as opposed to here.
You
But I
couldn't,
busted my ACL and I just had non-surgical.
you couldn't be a better client. Honestly, this is perfect. I'm going to show you something now that's going to blow your mind. Okay,
Mhm.
bring your arms out again. So we think that if you put your weight on your left side, it gets weak, right? So
Yeah.
that could be the ACL, it could
Yeah.
be a number of things. Look
Yeah.
over your right shoulder. Now do the same test. So it's not the ACL, is it? So what we did, we were expecting, based on what I found, we were expecting there's a restriction somewhere in your neck that's creating that weakness. So just by changing the position of your neck, when we talked about rotation, all of a sudden all that strength came back.
Mm-hmm.
So do you think that would benefit you if both sides were working equally, both were strong, just from changing some postural issues? And that's really the
Yeah.
clever bit of this. You're a perfect client for that, honestly. It's like you're a setup. Thank you. Don't sit down, Uncle Joe. Right, so I want to try that with somebody else. Does anybody else want to try that and see if they got? Yeah, come on in. It's really interesting because it's so practical and it's so obvious straight away. So there's no guesswork here. Okay, we're going to do it this way. Okay. So you just there you go. Okay, so arms out straight. Okay, show me how strong you are. Okay. So again, quite difficult to push you down. You're quite competitive. I can see that. You've got the eye of the tiger going on there. Okay, so put all your weight on your left leg. Are you right-handed or left-handed?
Right.
Okay, stop me pushing down. Now that feels more difficult, right?
Yes.
Yeah. All your weight on your right. What a difference. So I'm probably going to find this on most people in the room. The left is weaker. And it's not because you're less dominant or anything like that, or you've got an ACL problem or anything. Go back onto your left side again. Okay, stop me pushing down. Okay, now, let's see that eye of the tiger again. Look over your right shoulder, far as you can. Now stop me. Now that's not me pushing less, is it?
No.
Much stronger. And it's right the way through your posture. So, remember what we talked about. If you want to get the brain talking to these things, so the reason, take a seat. Thank you very much. What's your name, sir? David.
Dave.
Dave. Oh, there you go. This is Dave. Right. So what is it that was happening there? Does anybody want to give me an idea of what we just did? Just by looking to one way, we can bring all the strength back. Why would that be?
How would that affect us?
Is it sort of like memory power and what you programmed your memory to bits react?
Yeah, but again, if you were looking straight, those things would still be there, wouldn't they? So this is where chiropractic gets really, really cool. And it's still to this day, after doing this for 13 years of treating patients, it still blows my mind and their mind, but it still does to me. Let's just say you've got a restriction in your neck, and normally we would find it because of the weakness. So we know if you step on this side, there's weakness here, and there's going to be weakness here. And it's kind of chicken and egg. One causes the other, and the other causes the other. They kind of work together against you in cahoots. You don't know they're there because they're not a painful problem. Now, pain for me is the last thing that happens when you've got a weakness over time that gets restriction. Eventually you get pain. So pain is just a message. It's telling you eventually that enough of this, it's gone on for too long. So yours is a little bit more, yours was a little bit weaker than yours, so yours has progressed a little bit more. Maybe it's an age thing, maybe it's a fitness thing, I don't know. But when we looked over the right shoulder, what we do is we're actually allowing the spine to open up spaces where the nerves are restricted. So it's basically like, imagine you're stepping on a hose and the water's blocked. All of a sudden, by looking away, we take the foot off the hose, all that nervous system message gets through. You're now getting much more information from the brain to that side, so it's able to contract and control those muscles much better. What a beautiful thing. So all I've got to do is one adjustment, and we can do it manually, or we can use an activator, or we can just do some mobilizations, and you'll be twice as strong as you were when you came in for the first session. And that is, you've seen this happen, Janet, haven't you, in the room? You've seen that happen to you. It's been amazing. And I think it's something that I to this day, it still amazes me that we can achieve it almost instantly. And whenever I have a patient and we go for the report of findings and we do the consultation and we do the x-ray and we get everything up, the first thing I want to do is show them how powerful that is. And they walk out of the room going, wow, that's so much stronger. Then your body's going to coordinate a lot better because it's getting more information. So it's talking to the muscles and it's talking to the nerves and everything's functioning. So let's go a little bit further than that. Let's just say you're doing the same thing over and over and you get something like an arthritic problem. Has anybody got arthritis in the room? Jim, where do you have arthritis? Do you mind?
In my knees, in my wrists, and fingers.
Is it sort of just wear and tear?
Don't know really.
Okay. So-
my,
so-
my parents both had it, so
Yeah.
whether it's something in the genes, I don't know.
This is the thing that I find with clients, that when they're told by the NHS, and I'm not having to go to the NHS, they can save your life, they're brilliant, but they don't do the chronic diseases particularly well, because if someone comes in and they say you've got arthritis, they basically say, well, that's it, there's nothing we can do. But there are different types of arthritis, and then obviously there's rheumatoid, which yes, it's in your blood, it's a what we call a systemic problem. But when it's a wear and tear problem, arth just means joint, itis means what? Inflammation. So if you've got joint inflammation, why is that? Well, if you look at a joint, it tends to be these kind of things around the joint, not muscles. So they don't have a particularly good blood flow. So when a joint is under pressure, under wear and tear, what your body is doing is sending a lot of blood flow to that area to try and repair it. So this is why joints can be more painful, because they don't have a huge supply of blood supply. So a knee, for example, is mainly meniscal cartilage, and then ligaments and cartilage, because not a lot of muscle around the knee, is there? There's a lot supporting it. So that's why these joints can become more inflamed than other areas of your body, because they need more blood flow. So your body is sending inflammation because the joint is not working properly, it's getting wear and tear, and it's signaling in a response. So let's just say we get you stronger and functioning better. Do you think that joint will start to become less inflamed? It's literally what happens. Yeah, it's literally what happens. Once you start functioning better, your body doesn't need to inflame the area so much, you get less itis in the arth. So arthritis, joint inflammation. And this is what we find with repetitive injuries, is if you start getting strains and repetitive injuries, specifically golf or cycling tend to be another one, knees with cycling as well, is you tend to find that all you've got to do is get that joint functioning, get it back in balance, get it communicating better. All of a sudden, you have things that work a lot better, and gradually that arthritis dies down. Because arthritis is just repairing. It literally is just repair, but it's constant repair every day. It's a bit like having a leak that you never really solve. You just keep mopping up the floor. But if you fix the leak, all of a sudden, that water, that damage starts to dry out. And that's what we find with repetitive injuries. Probably the most important thing I can tell you today is repetitive injuries are just a big part of blood flow. If something's not functioning properly, get it functioning better, all of a sudden you can enjoy pain-free joints and pain-free life. So that's kind of a Brucey bonus in terms of when we're looking at posture, strength and stability. Any questions? Right, we're sort of coming to the end of our talk now. I hope I've covered, I mean, I always go and study loads of stuff, and I always forget to say certain things, and I'm going to remember when I leave now. But obviously, hopefully I've covered enough about why chiropractic can help golfers, why golf is such a great sport to keep doing, and why I want to keep people on the golf course as kind of a personal mission as much as my own private mission, because it's so good for you. And obviously, the more time you're on the golf course enjoying it, the less you would need to see somebody like me or any other kind of practitioner, because you'll have all the health benefits. Again, if you get better at golf, you're going to live longer. Take that away today. If you don't take away anything, that's an incredible fact, isn't it? And then on top of that as well, then you know you can all kind of practice these at home. If you go online, you can find a video. Tip list. Professional Institute exercises. Lots of people showing you how to do them and how to get them better. But we've refined it to help golfers get better at golf, not just pass a load of tests for the sake of it. So the other thing we like to do today, as part of our kind of talk, is maybe if there's something that interests you and you want to look a bit deeper and you want me to kind of go through this process with you, we've got a special voucher in your pack. We've got a couple of little freebies in there. And the voucher, the normal price of the full examination, x-ray, the tests, the report of findings, all that would be cost normally over about £220. We're doing that at half the price today. So that would be £110 to do a full examination, not just the golf, but the posture as well, the chiropractic side, and check all your neurology like we did with you guys today. And then look at things we can do to, we'll do a report to tell you what we can do, include the x-ray as well. But if you want to book it today, if you think it's something you really want to do, we'll reduce that again down to £55. So you get to spend an hour with me going through all this stuff for just £55. Price of a game of golf, I reckon, isn't that the same price? And then from that you can get all the information you need to decide if you want to move forward and if you want to do some treatment, and that would be very clear as well. We'd have a really clear plan, including exercises and including that all as part of that package. This is what we do all day long. Like I said, we've done 2,000 treatments just this month alone. I did probably a quarter of those. But my job here is to give you personally a bespoke examination, bespoke report, and a bespoke pathway back to wherever your goal is and wherever you want to get to. And that's really my job, is just seeing people get back to enjoying mobility, enjoying a pain-free life, and exercising. And I think everyone in the world's a lot happier if we're all happy. Yeah. So thank you so much for coming today. In fact, it's been a really nice group. Thank you guys for getting up. If anybody wants to kind of do those tests later in a minute, I'm happy to do them with you. If anybody wants to talk about their own personal thing, I'm going to be hanging around for a bit. And if you do want to book in, if you do want to take that offer, that special offer today, Andrea will either get your appointment today or take your payment and you can book in another time. Okay? Any other questions before we...
Yes, one question. When I sat down first of all and I saw that, I thought, oh my God, I'm going to look like a right dick standing at a first tee, sort of spending 20 minutes using that as my... No, but do you have any particular thoughts with regards to a warm-up regime?
Absolutely. I've got kind of my five kind of go-tos that I use, and they are kind of like do you want me to show you? Yeah. So my favourite is to just go down on the back of my feet. Not everyone can do this, but eventually you want to be kneeling, okay? And then what you want to do you know everybody know the cat camel?
Yes.
But you want to do it actually here. So it's basically this and this. Okay, and then I just do that at the thing. I look like I'm praying. I look like I'm from, I don't know, the Middle East or something, and I'm praying to Allah. And I do a little bit of that. And then what I would do is my 90-90s. So 90-90 hips. So I go this way, stretch up a little bit there. So stretching your back and your hips, and then I do it the other way around. And I tend to switch over from side to side. And I obviously you can do that in the in the clubhouse. So if it's a nice dry day, you can do it out there. Again, what I'm looking for is rotation then as well. So just really nice swings. If you think about what you're trying to do with the golf, and then just lean forward a little bit there, it's really this shoulder that wants to be down here, and just getting some swings. So you're getting into the habit, you're getting blood flow. There's no point doing stretches if they're not designed to do the thing you're about to do. So, when I see people doing all these kind of like giving it all that, and when I go running, I'm in a running club, I'm like, why don't you just do a little bit of the thing you're about to do? So kind of do this. So you're actually doing functional things that you're about to do, and it gets things warmed up in the way that you want to. So those are kind of I would say those are my kind of three big ones: the forward stretch, the thoracic cat camel, and then obviously the hips, because those are the things that are really getting into action. Obviously, the other two that I do is just wrists and arms. So just getting, we do these kind of get the wrists moving and just basically just pulling, getting some restrictions out. So when you go into that, because that tends to be the thing I find I have the most problem with, because I spend all my day doing chiropractic, my wrists are always under a bit of pressure. And then the last one then is just neck, just getting the neck moving up and down. Yes, there's a nose, and it's just really simple. And again, it's something that I find is my personal, it gives me the best bang for my buck. I mean, you could do all of those, couldn't you? You'd be there all day, but I find those kind of really cover rotation of the thoracic cage, and let the arms swing, rotation of the neck, 90-90 hips, and thoracic cat camel, and then obviously getting the wrist warmed up as well. And then when I hit the ball, guess what? Magic every time. Perfect. It's honestly, full disclaimer, I hate this game as much as I love this game. It is literally one of the most frustrating things I've ever done. But I'm not a quitter. I'm gonna see, especially when I'm retired or I'm semi-retired, I'm gonna see if I can crack this game. And I'm sure, you'll probably hear me screaming out upon the course. And then another one, it'll be just a beautiful, and that's what's so frustrating. It can just be beautiful, where you just land right next to the hole, and you go, I got it. And then the next hole, ding, 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 ding. Right, thank you very much, everyone. It's been a pleasure. Thanks for coming in.